My name is Juan José Fernández Romero, and I'm the policy officer here at the European Patients Forum. We are a Brussels-based organization in Belgium, and our members are national or disease-specific patient organizations, in total about 78 patient organizations. That means that the work we do is not aimed at individual patients specifically, but rather at patient organizations who then in turn work with individual patients. Now, what I would like to show you today is a project that has already ended, in which we participated and for which we provided the patient input. This project was called COMPAR-EU, and I want to show you a little bit what was the outcome of the project. How can you use it for your own self-management of the chronic disease that you may have, and what were the results? Now, for that, I would like to start, let's say, from the very beginning, and I will kindly ask you if you can see my screen, and more concretely, if you can see Google. Can you all see?
Yes, we can
Yeah.
see you.
Okay, so it's very easy. You Google this term, compare/EU, then you search it. And as you see right here, the very first page you are directed to is this one. It says self/management.eu or COMPAR-EU self-management. Now you click here, and then this website opens. Now the website that you're seeing now, which I will show you a little bit, is the outcome of the project. This is the thing that we, the European Patients Forum, participated, and which I invite you all to listen and to look. The address is here in the upper tab. I will share it in the chat of this conversation after I finish speaking. Also, this is something I will reiterate at the end, but next to the link to the website, I will also share my personal email. So if anyone in the audience or in the room has a question for me, perhaps not right away, but tomorrow, the day after, or whenever, please know that you can reach out to me whenever you need. I'm available and I will answer as quick as possible. Anyway, coming back to what you see on the screen now, this is the website of the COMPAR-EU project. It has different options. There's one of them which I would like to show you today, which I will do now. Although I invite you and welcome you all to go to the website and for the lack of a better word, to play with it. Now, the first thing I want to show you is you see here this red circle reading lay summary. If you click on it, this is one of the things that the project's developed, which are lay summaries for patients. Now, you see 5 of them here in front of you. For example, this leaflet on chronic obstructive pulmonary disease, heart failure, obesity, type 2 diabetes, taxonomy, and also in here for, the full lay summaries. I will, for example, click on this one, lay summary on type 2 diabetes mellitus. You simply click on the PDF icon here on the left, and then it will take you straight to the document. Now, this is this long version of the lay summary on how patients with diabetes type 2 may work towards their own self-care and, may better engage in managing their own health. Now you can see here a series of recommendations, supplementary outcomes, things that can be done that could not be done, and so on. And back to the same website, if you go to the leaflet, actually, and just on the upper side, you can get to see the same, but as compared to this one, to this version, this is mostly text. Now you can see a summarized version of the summary to explain, which is a little bit shorter, a little bit more graphical. It has some drawings, and is overall, I find, more patient friendly. Now, these that I showed you and many others are available here on the website. And if you go to the end, the on chronic obstructive pulmonary disease is available in many languages, and for the other diseases it's the same. I don't think all languages are covered, but most of them, including Maltese, as you can see here on the screen. I will click on this one just to show you. As you see here, it's fully translated. Now, if we go back, with your permission, to where this all started, to the very first page of the website that I introduced to you. Now, again, this is the COMPAR-EU website, and one of the outcomes of the deliverables of the project was to publish a decision aid platform that is a platform with multiple option selections that will enable patients living with a chronic disease to create a sort of summary or a set of recommendations for the patient to then take forward with the healthcare professional of choice. If you click here in the upper side of the website where it reads platform, very simple, one left click, and then you scroll down, and then it says welcome to the COMPAR-EU platform. These are some of the things that the project has developed. Now, the decision aid platform, which I'm going to show you right away, is available for the 4 chronic diseases or for the 4 chronic disease areas that you see on the screen right now, namely type 2 diabetes, obesity, chronic obstructive pulmonary disease, and heart failure. If you go a little bit down, for each of these 4, all of these have been developed. Now, interactive summary of finding tables, evidence to decision frameworks, a summary also what matter to patients, other stakeholders, repository recommendations, and so on and so forth. But for today, I want to emphasize my presentation, and the thing that I want to show you the most is the very first one. You see right here on the green box, patient decision aids. Very simple again, same as before, one left click, just wait a little bit, and then it will bring you to the platform. Now, we are going to guide you through the platform that this project has developed. It is free to use, it is public available. The first thing you need to do is you see the 4 disease areas here. Today, just to pick an example, I'm going to pick type 2 diabetes because I know this disease group very well. But when you're at home or whenever you feel free to pick any of the 4. I click on diabetes, scroll down a little bit, and these are the 5 sections of the platform I'm going to guide you through. Health effects, know your options, does it work, about yourself, and the summary. Very simple again, we just start. And then the website or the platform, better said, it welcomes us with a description on health effects. Now, we are allowed to pick, in the case of diabetes type 2, but it's the same for the other conditions actually, up to 3 health effects we want to improve in our self-management interventions, that is, in managing our own health. This range, in this case, from adherence, blood pressure, sugar in blood, dietary habits, long-term complications, physical activity, self-management behaviors, and so on and so forth. We will pick 3, and then the platform is going to guide us through those 3, the 3 that matters the most to us, and provide a series of recommendations. Now, for these 3, for example, HbA1c, blood pressure, and lipid profile are very, very important for type 2 diabetes. So these are the 3 I'm going to pick today. Again, very simple, just a left click. If you leave the arrow on top of the image for a little while, it will give you an explanation on what it means, so you can read it as well. And then you simply click on the 3, you go at the bottom, and then you click on next. Very easy, very simple. I can do this, and so can you. Now, the platform is a bit more concrete. There are 3 columns in which we need to say how do we want to frame, let's say, our self-management intervention, taking into account communication, participation strategies, and support strategies. And then the first question that we are asked is, how would you like to interact with other healthcare professionals when participating in a self-management intervention? We may choose that we have no preference, we may choose remote only, or we may choose face-to-face at the primary care center or at the hospital. For most patients that I interviewed when developing this platform, most of them, they say that they prefer face-to-face interaction, and that's what I will pick today. Now, once this is selected, the platform will ask us, how do you prefer to participate? In individual sessions between myself and the healthcare provider, in group, that is with other patients like me, and then we work together on how to best handle self-management and self-care interventions, or I have no preference. In this case, I would choose this one in group, which again seemed to be rather popular among type 2 diabetes patients. They wanted to come together with other patients to discuss with each other how to best self-manage diabetes in their case. And now, in addition to these 2, the platform is going to ask us, which of these support strategies would you like the most? Monitoring techniques, education, emotional-based change techniques, social support, shared decision-making, and so on. Next to each of these, there's a black eye. You see, if you put the arrow on top, it will give you a quote on what does this mean. Now, education, I want to learn more about medicis. Monitoring techniques, I want to learn how to monitor medicis and the benefits of monitoring. Now, you can even go as far as clicking on this see more, and then you can even see an even more detailed explanation of what this means specifically. Now, again, the options are endless. You can play with them. For the purpose of today, I'm going to pick education and monitoring techniques and shared decision making. Now, for example, in here you can choose more than one, but one at least. You go to the bottom again and you click on next, and you let it load for a little bit. Now, does it work? Now, according to the type of preferences that you have, the health interventions that you want to improve, in this case, blood pressure, sugar in the blood, and lipid profile, the things that I want to do the work, what is recommended, what is not. Now, for example, monitoring techniques, when it comes to the blood pressure, the app, and this is all based on scientific evidence, it may result in a difference in the diastolic blood pressure, although the evidence in this case is not very certain. But however, on HbA1c, it is highlighted in green because monitoring and action-based and emotional techniques do have a positive impact on the self-management when it comes to this health intervention, similarly on the profile. And well, in here you can see the results that this developed, let's say. Now, if you go to the very bottom of this page, and I will come back to this at the end, you can, if you are curious, you can check all the health effects. Health effects, as a reminder, are what we choose at the very beginning. I choose the three that you see here. So you can, let's say, in a sense, rewind and choose others. Or you can see, as and I will do here today, this is like a detour within the application. What are the most promising interventions? I will click on here. It's just for us users to see. And now you see it's practically the same table, but others are managed, such as quality of life, hypoglycemia, life expectancy, long-term complications, and how the different techniques of monitoring or action-based techniques, social support, may impact this. The scientific evidence is limited, therefore not all of the recommendations that the app provides are fully based on published evidence. But if they are here, it's because there was data available in any case. And the ones that you see with the green highlight on the back are those that are for sure or for certain the most widely available. You can go to the bottom and see more, and it will keep on expanding the table. This is very, very detailed, and it's for you to play and for you to see when you have time. Now, we go at the bottom, and then we click on next one more time. And here the app is going to ask some data about ourselves. Now, it will ask us for our age, when we were diagnosed, what type of regime, treatment regime do we have. Now, for the sake of an example, I will say that I have maybe 50 years old. Thankfully, it's not my case, but the average type 2 diabetes type 2 patient is about this age when diagnosed. When were you diagnosed, let's say 3 years ago, and then on the type of regime, lifestyle changes, oral medication. Have you suffered of any health complication? We can say yes. Did you undergo any surgical intervention because of the health condition? We can say no. And other type of health problems, again, we can say yes. And then it's going to ask which ones. We can click, for example, depression, heart disease, and high blood pressure, which I think these are rather common. And then on a scale from 1 to 7, being 7 the highest and the better, and 1 the lowest, of course, how comfortable do you feel about taking action and following a self-management intervention? And we're going to say 7, of course. What a question, right? And then check what you need to do before you can start following a self-management intervention. Nothing, I'm ready to take actions. I want to discuss my options, or I want to learn more about my options. We're going to select, for the purpose of today's example, that we're ready to take action. Now we click on left one more time. And now the platform is going to do its work. This last step will take a little bit longer than the others because it is producing a summary for patients to print. There we go. And what you see here is like a summary with all of the options that we have selected throughout. You can print it, you can save it for your own archive. It gives guidance and support on how to implement self-care techniques, again, for the 3 health effects that you selected as most important to you at the beginning of the platform. Now, again, what is the evidence on this? Where is there more evidence? When there is less, what interventions, again, the one highlighted in green, we know for sure that work best. And now it's basically everything that we have been discussing today, including the personal data here at the end. Should you wish, here at the very top, you can click on this icon of a printer, and then it will take a little bit of time, but then you can print this again for your own records and to be discussed with your own healthcare professional when you discuss your disease, especially the upper part that is me in this case as a diabetes patient. These 3 things are the ones that are the most important to me. What can I do? How should I do it? This is how I want to tackle my own self-care. I want more education. I want to learn about monitoring techniques. I want to do it in group, so on and so forth. And then lastly, this is my personal data. You can print it. I won't today, but you can do this at home. And this is about it. This is the platform. I hope you find it useful. Again, I'm gonna share the link here in the chat together with my personal email. Feel free to come back to me should you need anything. I'm available for questions. And also a very important point that I think I should clarify: this data is not saved in the app or is not saved in the website. Feel free to use it. Feel free to make an use of it as you think is best. But for privacy purpose, only you can share your own information if you decide to print it and bring it anywhere else. Otherwise, worry not. We're not sharing this information. We're not analyzing it. We are abiding by the highest standards of data protection. This is it for today. So I will now stop sharing my screen. Thank you very much for listening to me so far. And if you have questions now or later, it doesn't matter. I'm here available and connected from Brussels. So please feel free. And thank you very much for listening.
Thank you, Juan. Can you hear me?
Very well.
Okay, thanks. Thank you for this presentation. It's mind-boggling, and there are so many questions to ask about it, especially about who is going to interpret these tools to patients. But I open the floor. There must be many questions waiting for you. Who would like to start? She's asking whether patients themselves can access the websites.
So I've put the link to I've put the link here in the chat. I will also put the link to the platform specifically. You please feel free to share it with the people in the audience, because me being in Brussels, that's as far as I can go. But of course, it's free, it's available, it's online, and here you can find it. It's in the chat box, and please feel free to share it further.
And there are different languages.
Yes. There's Maltese as well. Gertrude and I worked very hard on the Maltese.
So the website and the platform is available in English, Dutch, French, German, Spanish, and Greek. But the lay summaries that for the different self-care interventions and the different disease areas that the project have produced are in Maltese as well. I think I'll put that a separate link to those to make it more clear. Again, lay summaries are in Maltese. The platform itself, unfortunately, not in every language, but in several, including English.
Other questions?
How long will the platform be available? Is there a plan for sustainability?
So for the years to come, for sure. Of course, I don't know what the future is going to have, but at least for the next 5 to 10 years, it should be online, no problem.
Oh, but what about updating regularly? How will that happen?
So the platform is now in the hands of the European Commission, because this was done in the framework of a project. Now we have just published it, and I cannot give you more details on when it will be updated for the next time. I really do not know. I guess it will depend on the input we receive from the users, on the European Commission demands, should they wish to change it or to update it. But again, at the moment, I cannot say anything concrete on that, and I'm sorry for that.
Sorry, will other conditions be added onto the website?
I think
to the platform?
I think not for the moment. That's the input we got. So we So when this project, so when the European Commission gave a grant to this project, the focus was to first, the idea was to first focus on these 4 disease areas that I showed you before. We see how that works. We'll see how, if patients uptake it or not. We'll see how it flies, and then we may add other conditions. Again, it will really depends on how it works. But being very honest with you, that would depend on whether the platform succeeds or not. And in short, the answer is not for now, no more conditions for now, but hopeful in the future.
Excellent, thank you.
Wanted to say something? Oh, sorry.
We-
Other questions?
So the individual can't save what he's inputted, go back to it next
I
time.
can print it.
He can print it once, but next time he goes in, he has to change it again.
Yes, so if I heard, because it was a bit distant, this participant, indeed, the platform doesn't save the information that you provide to it. So you do it once, then you have the option to print it or to save it in PDF. But then if you close it and get started again, and this is, I think, the question I was asked, then you need to start all over. The platform will not save any of your data. That would have been illegal. So if you want to save it, if you want to save the outcome, you need to print it or save it yourself in PDF in your own computer. Well, the platform, and this is a very important to make, does not storage any participant's data.
Okay. Juan,
Because, yes,
who's going to promote the platform? And let's say, as some of the participants are saying, they access the platform, they fill in the options and they print it. What do they do with it? If clinicians are still not sensitized to certain interventions that this platform is promoting, it needs promotion, no, first?
Absolutely. So the answer to that, I think the answer to that is twofold. There's 2 answers. Now, on the one hand, how and who is going to promote the platform among patient groups and patients, and then healthcare professionals, and these 2 should be distinguished. As the project developed, we did our utmost best in disseminating it in both. However, we are only so many and the scope was limited, but I will give you examples now. On the dissemination of the platform after the project ended, there is plans in place together with the sustainability of the platform itself. These are being done both by the European Commission and by project partners, including the European Patients Forum, such as events as like the one I'm talking right now. However, we can only go that much, that far. So we also rely on patients and the people who use it to disseminate that a bit further, should they think it's useful. Now, the second part of the question, which is the most difficult one, how to disseminate this among healthcare professionals. So, for example, while designing the platform, I myself had many interviews with doctors and nurses from Spain to show them a prototype. What do you think? Collect input. Do you think this is useful? Do you think you will use it? And then the input they provided was merged together with the platform. Many of them already know about this. Many of them are possibly already sharing it in the primary care settings they work on. But again, not all of them. This is a very new project. It's not known by everybody. And there's an underlying problem, not necessarily in the hands of the project, which is how about that doctor or that nurse who says, I'm so limited on time that I don't have time to look at half a paper. I have 3 minutes for my patient. I need to get it done in 3 minutes, and that's about it. Well, unfortunately, we don't have an answer to that, as you may imagine. We worked on it. We tried to raise awareness among healthcare professionals, but the bottom line is not only for us to make sure that everybody knows about it, they need to want to use it too. You know what I mean? It's not solely on us. And I remember I was interviewing a doctor once, and she was very nice for the most part, but she said, I only have 5 minutes tops with a patient. So I will ask my 10 questions, I will get 10 answers, then I'll give the patient a treatment, and there's no more room for more conversation. And then I said, yeah, but how about the patient expectations or feelings, or, is this working? Is it not working? Is the patient actually giving an opinion on the treatment that you're giving to him or to her? Like, is the patient feeling empowered? Then she said, no, I have no time. And, I could not really say I could not say any much to that. And it's a pity, it's a problem, but again, we cannot tackle it on the project. I hope I've answered your question. I think it took too long in answering, but it was a very valid point.